MC for today. As a member of Ready Nation, a cohort of business leaders who advocate on behalf of kids, a former Southwest Airlines executive and the current membership director at the Galveston Regional Chamber of Commerce, I am thrilled to be here today amongst our business and chamber community leaders from all across the state of Texas. To be exact, we have received nearly 300 registrations for this event, representing 63 different cities and 28 chambers of commerce throughout the state. So thanks again. Just a few items before we get started. There will be a Q&A portion, so if you have any questions or comments, please feel free to drop those in the Q&A chat box, and we will try our best to answer them at that time. Also, if you would like to talk about this event on social media, please use the hashtag PN3 Collaborative. Okay, we have some great speakers for you today. First up, we are delighted to begin this event with President Robert S. Kaplan of the Federal Reserve Bank of Dallas, where he oversees 1,200 employees. Rob has had an extraordinary career as an associate dean of the Harvard Business School and as vice chairman of Goldman Sachs Group, where he had a long career. Rob is also an author of many books on leadership, serves on several corporate and nonprofit boards, and currently serves as chairman of Project ALS, as co-chairman of the Draper Richards Kaplan Foundation. Rob will spend the first 10 minutes or so of his discussion laying out his view of the economy and issues related to the supply of labor into our current and future workforce. We will then have a 10-minute question and answer session. Rob, thank you for being here today. We know you are deeply knowledgeable of the current economy. Please help us understand our current state and challenges.
Great to be here. So I'll make a few comments. Our own view at the Dallas Fed is that GDP growth this year, for the year 2021, will be in the neighborhood of 6%. That is a somewhat downward revised forecast than what we had a month or two ago, and that we've revised down our third quarter GDP numbers. This is primarily due to the resurgence in the COVID virus, the Delta variant. But we still believe the economy is recovering, that the fourth quarter we will have solid growth, and we'll have solid growth in the next year. The issue is that the resurgence has not reduced overall mobility and engagement. It's kept it from improving, but it has hurt travel, leisure, hospitality, and a number of sectors, not surprisingly. And it's also slowed the matching of open jobs to workers. And fear of infection continues to be an impediment to coming back in the workforce. People staying at home to be caregivers. There's probably 1.25 million, 1.5 million people who've left the workforce who are caregivers because of this situation. And there's approximately 3 million people who have retired since February of 2020. And so the long and the short of it is we've got a very tight labor market. And it's probably tighter than the headline statistics suggest. There's a lot of wage pressure. Every business I know is having a hard time hiring. And I think that's going to go on for an extended period of time. And it's also increasing costs of business, that along with raw material supply demand imbalances. So let me, that's sort of a headline. Let me talk a little bit about workforce more specifically. GDP growth is made up of growth in the workforce plus growth in productivity. And US population is aging. Workforce growth is decelerating. And it's not being made up for in improved productivity. And so what can you do about that? We can't do a lot about the aging. We could do more to make it easier for women to be in the workforce. That's childcare, for sure, affordable and access to childcare. obviously ensuring that schools are reopened in person. But and so there's things we can do. Immigration is a sensitive topic, but that's part of the discussion. But on productivity and getting productivity improvements, there are a number of things that can be done. Early childhood literacy, improving that, improving skills training, improving access to Wi-Fi, all the things that can improve labor force productivity, I think are very critical to the future and the future of the labor force. Access to healthcare. We've seen healthcare outcomes very different based on race and ethnicity as a result of COVID. And one of the big issues is, we're seeing, this is laying bare, that there's educational impediments, there's healthcare impediments, there's healthcare trust among certain of the fast growing groups, and that, for example, they may not trust the vaccine. And we're seeing all this reflected in workforce and the availability of workforce and the tightness of the workforce. So I may stop there given the limits of time, but there's a lot we need to do more to improve the growth in the workforce and the productivity of the workforce. And I think that's a big issue in the United States. You're on mute.
Yeah, thank you. Thank you so much. We would entertain any questions from anybody that's got any questions. Put them in the chat box, and we will definitely address those for you. While we're waiting for our questions to come in, we have what is your view on the affordability and quality issues of childcare? Is one more important than the other?
It's part of the puzzle. It's critical. Access to childcare is critical to allowing women to be in the workforce. And what we're seeing in the childcare industry, it's a very fragile industry. It works on thin margins. The pay is relatively low, and it's been hurt badly by COVID for obvious reasons. And so there's going to have to be a lot of work done to reinvigorate childcare and childcare access.
One question that came in: we understand the issues, so what do we do about them? Childcare is essential for working families. However, we must have a viable workforce to deliver the service. Childcare has a direct impact to the community's economic development.
Yeah, so all of us need to do something about it. And that I think it's more than just the government, state, local, and federal. I think nonprofit groups can do more to help beef up childcare, to get funding to childcare, to help these struggling childcare entities to get on their feet. And I think a nonprofit world and the business world, private sector is going to have to do a lot as part of this.
What role, Rob, can businesses play in supporting the workforce of today and tomorrow?
Well, this is where skills training, but also before it ever gets to the business, you can do a lot to help with early childhood literacy. That includes childcare where kids are read to. It could be nonprofit programs that improve early childhood literacy. Businesses can help back those. I think a lot of those steps can be helped by business. And then obviously when you get workers in your business, but businesses are doing the training them, use of technology, investment in technology is all part of the puzzle also.
It seems like the puzzle has multiple pieces, Rob.
It does.
We keep getting questions. Do you have any recommendations on how employers can address the workforce challenge? How do we attract folks back into the workforce? You have mentioned better Wi-Fi, healthcare. Well,
in terms of attracting, there's no getting around it. The wages are going up. More flexible work arrangements are increasing. The ability to work remote. There's a whole range of issues that are making it harder to attract workers. And I think it's easier for bigger businesses than small, mid-sized businesses. They have more leverage to use. And so I think, truthfully, getting COVID under control, widespread vaccinations and mask wearing, right at the top of the list on things that need to be done to help address this.
And in your opinion, what should be the role of chambers of commerce and other economic development organizations?
I would say to prioritize local initiatives like improved childcare access, other local initiatives like that, and work with businesses, maybe to make philanthropic contributions to help fund this. I think there's a role for business and chambers of commerce to mobilize business to do this.
And in your opinion, where does Texas stack up in terms of its support of early childhood initiatives versus other states?
We're probably lagging in that I've noticed our math and science, our early childhood literacy, as well as math science scores, but early childhood literacy, particularly among the fastest growing demographic groups, is lagging. And the more we can invest in Texas full day versus half day pre-K, improving teacher comp, particularly for kindergarten, all those issues. And are other states doing a better job than us? They are. I think we've made improvements in the state, but I think the issue is we need to keep doing more. We've got the wind at our back in Texas. We've got enormous migration of people and firms to the state, but this is a real impediment that we have to address.
Okay. Have there been any discussions about, there's a question came in, have there been any discussions about potentially making childcare and early childhood education publicly funded, such as putting these services under the banner of the Texas Education Agency?
So I don't know all the debates on that subject. The issue might be philosophical, though. Do we prioritize? This is a decision. Do you want to prioritize half day versus full day pre-K? It's not an issue. It's not that we don't have the money. We have the money. It's a question, do we want to make it a priority? That's the debate.
And that kind of leads into the next one. How do early childhood investments stack up in terms of ROI?
They're the highest ROI investment we can make, in my opinion. There's no doubt in my mind. You get a long-term payoff, proves the quality of the workforce. And I got back, GDP growth is very critically dependent on it.
Do you foresee any political appetite to take more of a government-focused solution to childcare and early childhood education? It seems that leaving it to the private and nonprofit sectors is not working.
Well, you're seeing a talk nationally about doing more to fund this, but then it still has to be executed locally. And states still have the ability to make decisions to decide how to prioritize this. So that's still an issue.
Here's one from Lee Jackson. Decades ago, there were many efforts to start worksite childcare programs. They could not get enough enrollment in many cases, and most went away. Does the current environment change the value equation, i.e. subsidized on-site childcare may cost less or be more productive than more wage increases? Interesting question.
That's an interesting thought. I mean, that's a decision for every business, and it would be a nice feature to offer that if you're a business. It costs a lot of money, but I'm sure a lot of businesses are thinking about that.
And like we asked about the chambers, what would you see the universities like to see the universities do?
That I don't have a brilliant answer to. I don't know. In terms of for their own employees?
Might be. They were not.
I mean, a lot of universities do provide childcare for their employees, and I think that's an important thing to do.
Okay, and what changes in healthcare need to change to address the need to increase productivity?
Again, there's a difference in the fastest growing demographic groups. They're low, moderate income communities are very critical to faster growth. And we're seeing different health outcomes for those different communities and differences in their access. And so that's a local and a national decision how to prioritize, but it's affecting all of us, and that it means slower GDP growth.
Going back to the university question, we had a second comment on that. What would you like to see universities do? And it says, in terms of supporting the economic development of our region, this could be related to skill training, maybe.
Well, universities really don't do skills training. Junior colleges do, high schools do it. And I think a lot of universities feel that's not in their lane. So I think this is more the purview of junior colleges and high schools and workforce development boards working with them.
I'm not seeing any more questions here. I'm making sure. I don't see any more questions here. Rob, so, okay. Well, Rob, thank you so much.
Thank you.
Just see.
Very nice to talk to you.
Yes, and if you guys have any more questions after the event, we'll still have the chat box open as well. So thanks for all the valuable information in the dialogue. I think we noticed that we had quite a few questions. And so
good.
I'd like to next, so thank you so much.
Thank
Rob.
you. Good to talk with you.
Next on the agenda is Dr. Cynthia Osborne. Dr. Osborne is currently the Associate Dean at the University of Texas Lyndon B. Johnson School of Public Affairs. She is also the Director of the Center for Health and Social Policy, the Child and Family Research Partnership, and the Prenatal-to-3 Policy Impact Center. Dr. Osborne is a nationally recognized authority on evidence-based policies that strengthen outcomes for infants and toddlers. She will be discussing the highlights of a few areas of her work, which include the evidence base on which early childhood policies work, and how Texas compares to other states on early childhood supported policies. Please continue to write up any questions in the chat. Dr. Osborne, thank you for being with us today.
Well, thank you for having me. I'm so excited to be part of this discussion because it's really at the heart of everything that we do. Like you said, I have the privilege of directing the Prenatal-to-3 Policy Impact Center at the University of Texas, the LBJ school there. And I'm going to be saying next slide as we navigate through here. So to the next slide. And our whole purpose is to be a resource for states as they grapple with these issues of how to ensure that all children get off to a healthy start and thrive, so that we have a vibrant workforce, a vibrant community, a vibrant society. And why we focus on the prenatal-to-3 period is because the science is so clear that this is the most rapid and sensitive period of development, and it sets the foundation for all subsequent health and well-being. When a child is born, an infant's brain is making over 1 million neural connections each second between birth and age 3. And it's the time of the most rapid brain development, but it's the time that we give the least amount of investments to. And so when we can set the stage for kids to have these warm, nurturing, stable, loving environments, you can see the normal sort of brain development that occurs. But when kids are exposed to issues of adversity or abuse or poverty, you can see that the neural development is not as optimal. They actually have less neural development than in a typically developing brain. And the next slide demonstrates really how this changes over time in the first 3 years of a child's life. That the top green bar there is the growth that you see among children who are born into higher income families, and the blue line are those who are born into lower income families. And over 20% of our little ones are born into poverty here in Texas. And we make up 10% of the United States infants and toddlers. And that number is actually growing. And so it's really important that we focus on this period and that we get it right. Not usually would a 50-year-old woman say that wrinkles are good, but gray matter is all the wrinkles on your brain. We need more wrinkles, and we know how to do that. And the next slide, I want to, what we did was build on, in the next slide here, what the Policy Impact Center did was build on this science that tells us what we need for brain development. And we turned to the evidence base and reviewed thousands of studies to identify what are the best investments that states can make to really ensure this healthy brain development. And what we found is that there is no magic bullet. There is no way that one institution or one program can do it all. And it does require this system. And it's a combination, as President Kaplan was just saying, of high quality childcare, access to health care, and targeted family supports that actually meet the specific needs that families have. Our goal here is to reduce the stressors that families have in terms of financial instability, food insecurity, housing instability. All of that is so important and crucial. And simultaneously increase their capacity through parenting programs, through high quality childcare, and so forth. In the next slide, I'm going to talk about these three areas: childcare, healthcare, and family supports, just briefly. But the evidence is so clear that access to high quality, affordable childcare is such an important element of ensuring that kids get off to the right start. We know that high quality care increases cognitive abilities, language development, relationships. It has long-term impacts. We talked about the return on investment, and it really is the most important investments that we can make to see these long-term impacts on earnings and social behavior. And the way that the states invest most in childcare at this point is through our childcare subsidies. And the research is really clear that higher childcare subsidies increase maternal employment, they increase earnings, they increase maternal education, they allow children to enroll in higher quality settings, and they allow children to stay in settings. And we know the stability of childcare is so important. But let's see how Texas is doing in the next slide. We spend a lot of money in Texas on childcare. We're a big state, and we get a big federal grant, and we also put in some of our other dollars as well. And in this last legislative session and through this last regulations, we will be expanding the amount of money that we spend, but we need to, because we're not keeping up with the rest of the country. So when you look at, this has a lot of information, I'm just going to walk through briefly, but when you look at the base reimbursement rate, this is the amount of money that a child care subsidy would go to pay a provider. When you compare that to what the market rate price is, and we say a fair market rate price is somewhere where 75% of a family could buy 75% of the childcare slots on the market. We are only covering 77% of that, which ranks us 37th across the country. But our market price doesn't always reflect the real quality of care that we need in order to ensure that children have the type of experience in those childcare settings that they need. And we only cover just about 56% of that. But we also require that the families pay a portion of this. We require families to pay 9.8% of their income to cover childcare, which ranks us in the 42nd out of 51 states, including DC here. And when you think about the whole amount of cost of childcare that the family has to pay, we call this the burden that the family is paying for childcare. Even though we're putting up a subsidy, the family is responsible for nearly 53% of the total cost of care. And that leaves us ranking 49th. So we have to put more money into the childcare system in order to provide high quality care. In the next slide, I want to demonstrate how important access to affordable health care is. There has been a lot of really rigorous research done on what Medicaid expansion does and how having access to Medicaid, how important it is for our lower income families. And we know that it both improves health outcomes as well as economic outcomes and worker productivity outcomes. So both pre and postpartum care, it reduces medical debt, it reduces racial and ethnic disparities in both infant and maternal mortality, it reduces child maltreatment, and it improves our workers in terms of their productivity, reducing absenteeism and so forth. And the next slide, you can see that this is an area that we are really lagging the rest of the country. And it doesn't have to be that way. Texas is one of only 12 states that have not expanded Medicaid. And, this is not an ideological argument. This is an effective policy that actually leads to all the outcomes that I was just mentioning. But currently, Texas is required to pay 2/3 of all Medicaid costs. If it were to expand Medicaid, it would pay only 10% of the cost of those expansion states. And there would be a reduction at this point in the other Medicaid spending. And some of the studies that have been done have demonstrated that this is costing our state nearly $57 billion annually in making up those healthcare costs and lost worker productivity. And we're really toward the bottom here when it comes to insurance coverage, and that affects the kind of access to healthcare as well as quality prenatal care, which is so important to children getting off to a healthy start. No childless adults are eligible for healthcare in Texas, in any non-expansion state, except for Wisconsin, who decided to allow childless adults to be eligible. Among parents, you have to have an income that is below 17% of the federal poverty level. If you make more than $300 a month as a parent, you are not eligible. And that puts us at the very bottom in the United States. For pregnant women, you have to have an income of about 203% of the poverty level, which puts us really in the middle here. But when you look at the proportion of our childbearing age women who have lower levels of income, nearly half do not have access to health insurance. That puts us at the very bottom. That means when they become pregnant, when they're seeking to prenatal care, there's a long delay in being able to actually access that. And we rank 48th in the proportion of women who receive adequate prenatal care. In the next slide, I'm just going to briefly go through our need for access to targeted family supports. As I said, the research is really clear that if we can provide these nurturing, safe, stable, loving relationships, that leads to healthy brain development, self-regulation, success in school. There's lots of positive things associated with that. And when children are exposed to neglect or adversity, maltreatment, they're not having that optimal brain development. And Texas families report that they are the last across the country and the lowest, least likelihood to read to their children daily, for instance. 76% say that they don't do that. And this other indicator, what we call nurturing, where these are showing these warm, loving interactions with your kid, playing games and peekaboo and singing songs and the things that we do with infants and toddlers, we rank 48th. So there's a real need for us to be able to engage families and help build these skills so that they're interacting with their little ones in more effective ways. And the next slide demonstrates that we actually have, these are 4 different, what we call strategies on this roadmap that we have created to guide states on what the most effective policies and strategies are. And we're doing 4 out of 6 of these, but we're not serving very many kids. We have a lot of children here in Texas. I know that. And we're investing a lot, but it's not reaching as many folks as it needs to. So if you look through at both our early connection programs, our group prenatal care, our home visiting, our early childhood intervention programs, we're ranking either in the lower half or near the bottom in terms of the children who are served and who could benefit from these. So just in the next slide, I just wanted to open an invitation to all of you. Sorry, a little selfless promotion here, but to join us at our event that we're going to host that will go into a lot more detail about this roadmap and more information about how we can help kids get off to these healthy start. And I also, because these will be available, included our contact information so that you have access to us and we're here to be a resource for you. But thank you for the opportunity to share.
Thank you, Dr. Osborne. Let's see, we have a little bit of time for Q&A with you. And so we're going to go ahead and read a couple of the questions that came in. It says, what percentage of the 377,000 children born across or born access or require access? Okay, so what percentage of the 377,000 children born access or require access to childcare outside of the family home? Do we have data on brain development or of children in family homes care versus outside the home?
So about 60% of infants and toddlers are in some sort of childcare arrangement on a regular basis. And parents have a preference often for smaller environments for their infants. And as their children age, they have a preference for more of a center-based environment. And in Texas, we have several different types of arrangements where families can either go into center-based care, they can go into a family-based arrangement, or they can obviously stay at home with a family member or a close relative. And but it is around 60% who are in either the center-based or the family-based. And among infants, it's a little higher in the family-based, and among toddlers and on, it gets higher in the center-based.
Thank you. What is especially required to move a person to a high quality from the typical mediocre child caregiver? How challenging is that?
Well, if I were answering that question right now, I would be, doing something that no one has been able to actually completely understand how to do. So that is such an important question. I wish that we had a better answer, but we have some clues. The things that really that reflect high quality come into three different things. One, it's about the relationships that the caregivers have with the children. And in order to have those nurturing relationships, what's required for that is both the caregivers having the experience and knowledge and understanding of child development and how to interact with infants and toddlers, and the time and capacity to do that. So not having too many infants and toddlers to care for at the same time. The second piece is that we're actually caring for the caregivers themselves, that they are adequately compensated, that they are not dealing with some of the stressors that so many of them make. The average wage is somewhere around $10.50, $11 an hour. Many of them are food insecure and having some of their own struggles that then come into the classroom with them. And so when we can care for the caregiver, that increases quality. And third, high quality centers or family-based care, think about the family unit, not just the child, and the needs of that family unit, and try to connect them to the services that the family will need. So it's those three things that really go into high quality care.
Excellent. Thank you. That's a good answer. This is a little bit lengthy, so I'll read it from Connie Ritchie. In the state of Texas, it is required that we as owners make sure that all of our staff have at least 24 hours of training per year, hire date to hire date. They say that it is the responsibility of the teacher to get this training. The problem we have is that they do not do it unless we provide it for them, take them, and we also have to pay for the hours of the training and the cost of the training. This is a tremendous hit to the bank account. It does not help that we cannot find any teachers. We are short teachers and the teachers I have are overworked. We are having to put children on waiting lists because even now I have an empty classroom. I cannot put kids in a room. I have no teacher. It is reducing my revenue, thus causing another hit to my budget. In Louisiana, the school district has a lot to do with the child care centers and provides the funds for the training, along with a lot of other things that ensure that the child care industry is keeping up with schools. Is there any chance that we could get this in Texas?
Well, I'm going to let Representative Button answer any sort of questions about what's possible in Texas. But I think that the points that you raise are important points. And although the work that I focus on largely is about the well-being of children, the folks who own child care centers and who are there trying to provide this important care, it's a very difficult business, and they have to be part of the conversations to the solution, because there's no one making a lot of money off of this. This is all a service industry, and we have to find ways to make sure that this public good is actually funded in the way that it needs to be. So I don't have a solution directly for what you're saying, but I recognize the problem and how important it is.
Thank you. Let's see, we've got a couple more minutes. So I have a couple more questions. It said, of all the policy items to help families in the workforce, which would be your top two?
So childcare is crucial. Without high quality childcare, we cannot have a workforce of today, and it will definitely help us with our workforce tomorrow. So high quality childcare is so crucial. I think, though, that we have also seen that if we do not have access to health care, that we are really, it's costly both for the society and for the individual. And so I think that both of those are absolutely essential. And we are doing them, we're just doing them the expensive way. So it'd be nice if we kind of did it in a way that was a little bit more efficient.
Awesome. Well, thank you, Dr. Osborne, for all the insight and information, and thank everyone for their good questions. We'll get to any questions, hopefully, that we didn't address now after our next speaker. And before introducing our next speaker, I do want to make sure and mention that we will be sending out the recording from today, as well as the PowerPoint and the slides. So stay tuned. Our next speaker is Republican State Representative Angie Chen Button. Representative Button is a state representative from House District 122, which includes portions of Garland, Richardson, Rowlett, and Dallas. She is also the chair of the House Committee on International Relations and Economic Development. Representative Button was born in Taipei, Taiwan. As a child, her 7-person family lived in a 300-square-foot, one-room hut without a kitchen or running water. She credits education with bringing her to a better life. Representative Button will now discuss her work in the legislature on early childhood issues, as well as talk a bit about the newly formed Early Childhood Education Caucus. Welcome, Representative Button.
Hello, everyone. I am just so excited to be here, and thank you so much for having me. We do get to, as an elected official, we do get to invited to many panel discussions. And usually the rule is I prefer to be the first one to speak. The reasons, after you get things done, you get to enjoy listening to everybody else. And the other reason is for those questions cannot be answered in the prior speakers. Usually the last one on the agenda had the, feel like we have the responsibility and the stress to give you all the answers. But let me share with you, I am here to give you a sincere conversation and ask for your involvement to this very, very important child care, early childhood development issue. I'm not here to give you all the answers. I'm definitely not responsible for all the statistics you don't like happening, okay? But I want you to know that how we have done in order to improve. Okay, first, let me think that it is really a great honor to be at the same panel with President Kaplan and Dr. Osborne. And I want to share this story with you. I really like today's title, The Sky is the Limit. And if you look at the picture in the back, see, this room used to be my son's, we only have one child. I waited too long to have the second one and just cannot have it. We only have one child who is a wonderful kid, graduated from UT, went through all the way to the public school in Richardson. And now he just absolutely, he has 2 kids, my precious grandkids. But anyway, I might get into a position to brag about my grandkids too much if I don't stop right there. But I want you to look at this picture. We put this picture in my son's room because it says there's, you probably cannot see, but this is a little airplane. It's flying in the sky, in the cloud, and the rainbows across, because even when my son was a little kid, we wanted him to know that the sky is the limit. The sky is the limit. That says a lot, what we believe. Okay, and then I was one time I was kidding with my son that I think I'm just a B- mama because I'm having always working a career woman, and as the moderator during her introduction of me, that I worked for Texas Instruments for many years. I remember when my son was a little kid and we have to drop him off at the daycare, and every day when I drop him off at the daycare and driving to TI to work, I felt extremely guilty. I felt extremely guilty. I keep on thinking, should I quit my job so I can concentrate taking care of my little precious boy? And I believe many people in the audience, not only the women today, a lot of men, single parent, single father. For example, I remember reading the President Kaplan talk about that he's a single parent. So today, a lot of single parents probably feel more stress, even more stressful than how I felt. And back to those days, see, my husband and I, we all have professional jobs, but even there, we still worry about the quality of the daycare and everything else. So I was joking to my son that I think I, at most, can get a B- rating as being a mama. And listen, my son said, "No, mama, you are A+ mama." I was so shocked. I never had time to do those extra work for him. And then he said, "Mama, you're the only mama I know can teach kids calculus," which is the truth. So I was very proud of that. I said, okay, let's take an average. Count me as a B+ mama. Well, okay, put that story on the side. I want to share with you why I got into this early childcare development and the legislative process. Okay, as the prior two wonderful speakers mentioned, the childcare, so it's such an important issue, and I always feel like childcare is not only a family issue, an education issue, but it is really a workforce issue and an economic issue. As you can tell, that the two outstanding panelists, they share their insights with us. definitely that you can understand that, and the access to quality and affordable childcare definitely is very vital to our Texas economies and the major factors. And look at the American Rescue Plan passed by the Congress and the President early this year, and along with the CARES Act and then the Coronavirus Response and Relief Supplemental Appropriations Act passed in 2020, including the historic levels of funding for the state care, child care programs, and the federal dollars available. A lot of things, a lot of resources are coming in, okay? But I want to talk specifically what we have done during the 87th session, which we finished in late May. I was so thrilled when Speaker Phelan appointed me to chair the International Affairs and Economic Development Committee early this year. And I thought about the things that I really want to focus. And then it came to my mind. I was reading the interview that on the newspaper that they report interviewed President Kaplan, talk about how we need to do now in order to help to revitalize the pandemic and the past pandemic. It looks like we haven't really post-pandemic. We're still in, okay, the economic development. And one of the major points he talked about was the early childhood development. And it dawned on me, this is what I truly believe. And I think it is a good strategy. It falls in my territory because my committee also take care of the workforce development. And since it's related to economic development issues, I definitely would like to take the lead in challenging this very, very complicated and very, very needed issue. So we designated almost a whole hearing day on this very, very important issues. So I want to share with you what are some of the bills we have when we were able to, excuse me. Believe me, starting 8 o'clock, I was on my phone calling people, so losing my voice. But anyway, let me share with you some of the bills we have worked on and got passed, and what the story behind. Okay. First, let me talk about the HB 1792, which is my own bill. This bill improves the efficiency and quality of the Texas Rising Star, which is a government-sponsored early childhood development child care program. So the providers participating in this Texas Rising Star program need to meet a higher quality standards than many other child care programs. HB 1792 allows the state to oversee one central evaluation process for this program in order to eliminate inequality and possible bias in those readings, okay? And it turned out it makes really common sense. You gotta have a same standard to evaluate the child care systems and facilities out there. Okay, another very important bill, HB 2607, authored by Representative Tallarico, requires that all state-subsidized child care providers to participate in the TRS program, this Texas Rising Star program. And this move will improve the quality of care and the service and make sure that our tax dollars are used in the best way possible. Earlier, there were audience has questions about how can you have a, high quality childcare program? This is one of the another step we took how to improve that quality. Okay, but listen, and get back to this. Child care is only as good as the caregivers and the teachers. So we are talking about the dollar amount, the salary, the wages we're paying. HB 618, this bill was authorized by Chairwoman Thompson, and we call her Miss T because she's so powerful and she has such a great experience. Her bill requires the state to develop a strategic plan to look at improving professional development and to reduce turnover in the child care workforce. Okay, and then also finally another very important bill we passed was a HB, that's a Senate Bill 1555, authored by Senator Zeffironi and sponsored in the House by my House colleague, Representative Rainey. This bill leads to better childcare reimbursement rates. And I'm happy to report all those 4 bills I just mentioned, they are now all law in Texas. Of course, have we done everything? No, by far, we got a long way to go. But believe it or not, as I'm proud to say, I'm the first chairwoman in the Economic Development Committee ever designated almost the whole hearing to focus on the early child care issues. And also, good news, this session, we also set up this early childhood caucus, and it's another bipartisan effort. Oh, by the way, the 4 bills I just mentioned, 2 authors are Republicans, 2 authors are Democrats. We got a support from my colleagues, across the board. It's really, truly bipartisan efforts, and I'm very happy about that. And this early childhood caucus, that the Democrat Representative Diego Bernard, he is a member of the Public Education Committee and have a lot of experience in that field. He is the chair, and I promised my husband I don't take any more leadership responsibility because I'm already up here. But somehow this is so important, so I decided, okay, I just force myself a little bit further. So I am now the vice chair for this caucus, and I'm very optimistic about what we can continue to build on the victories we did and we saw during the 87th session, and with a team of bipartisan legislators committed to ensuring that our state policies give kids a strong start in life, economy, and for children in this state will only improve, especially children at risk, which is another area next session I will focus on. As everyone here knows, there are so many opportunities for all of us to come together to support our little Texans. And once again, let me repeat what I said earlier. The child care issue is not only a family issue, an education issue, but also a workforce issue and economic development issue. So thank you for having me here, and I'm just absolutely excited and very much appreciative.
Thank you so much, Representative Button. We always love to hear from you and really appreciate your support of early childhood education issues. We do have a couple of questions that had come in about you. Let's see, for you, I should say. Let's see, we have the one that came in earlier was looking for it now. Given the importance of childcare to getting, sorry, this is going back and forth. Given the importance of childcare to getting the economy back on track and the high ROI, will the Texas legislature ever decide to fund more childcare subsidy? And you touched on that a little bit, but if you, is there anything else that you'd care to address there?
Well, you know, I know we're actually looking at the federal fundings and to make sure that we allocate it with the most efficient way to handle that. And nothing is for sure when we have additional funding, and this is something we've been pushing, and hopefully people start to realize that, you know, it is bottom line, it is an economic issue, and it is important to the future of our state. So I cannot, since I'm not in the appropriations committee, and I can now speak for the committee chairman, Dr. Button, but I know that this regular session, the 87th section, and I am proud to say we wake a lot of people up. We did. And I am so appreciative towards many nonprofit organizations. I'm not going to name names in case I forget somebody, then you get mad at me. But there were a lot of great, very supportive Twitters and Facebook's comments coming in, say, hey, listen, how come we never talk about this as a designated issue for the economic development and workforce development? And I'm so glad Chairwoman Button, and I feel like it was kind of my husband say, you know, you being around, and you have chaired 4 terms and additional term for the select committee, and now people start to see your value, and the Texas Monthly even recognize me as one of the best legislators. And I'm just so thrilled. Of course, once again, my husband joked about this. How come they didn't mention all the things you have done in the past? I said, I think they know that. But this very important issue, we now start to put emphasis. I'm going to continue to work on that. Yeah, hopefully we will have more resources, hopefully.
Thank you, Representative. Then we had, I believe, forwarded 3 questions to Dr. Osborne. Dr. Osborne, are you still with us?
I sure am. Let's see, you forwarded questions to me that you want. I'm sorry, I wasn't sure if you were going to ask them or not, but there were some questions that came in that I can just try to address if I remember them correctly. One was how the business community can help to craft, to become part of this conversation and to encourage public policy leaders to think about childcare and early development as essential for the workforce, both today and tomorrow. And that is what Ready Nation and Early Matters have been doing, both in Texas and Ready Nation across the country. And they have a unique and important role to play because they see the impact that it has immediately on their workforce. And they also understand the skills that that they need in order to fill their workforce. And so for them to be able to make the economic argument about why it matters, you know, everyone thinks that babies are cute and cuddly, but they are also an investment for today and tomorrow. And if they can help us to make that economic argument, to help us to think about how it will increase productivity, those are going to be important messages that they're in a unique position to share. There was another question that came in that had to do with the trade-off between pre-K and childcare. And as everyone on this call probably knows, Texas has been leading the way in investing in public pre-K for 3-year-olds and 4-year-olds. And this is an important step in the right direction. But our 3 and 4-year-olds, they often help to cover the costs for the infants and toddlers. Infants and toddlers are very expensive in childcare because you can only have a few of them with a teacher, whereas 3 and 4-year-olds, you can have more. And so I know that the state has been grappling with this issue of how to make sure that we don't completely deplete the capacity of our childcare centers, but more is going to need to take place in order to keep our childcare in sustainable. And pre-K is only half day, and so those children have to be in childcare afterwards. So we cannot think of these as 2 separate markets. They are one market that have to do with children and their ages birth through before they enter kindergarten. And they're funded in different mechanisms, but they have to be thought of as one market. And if we segment it out, we're going to hurt one at the expense of, help one at the expense of another. And I'm sorry, I'm not exactly sure what the other question should be. So if
that's okay, Dr. Osborne, because we're just about out of time, and we want thank you so much. You addressed the major ones. For all our participants, you're about to see something pop up on your screen. We are about to do a quick poll with just a couple of questions for some feedback on our event today. If you don't mind, please click through those. It should only take a few seconds. Okay, so I'll give you a couple of seconds here. Do you have a greater understanding of prenatal to 3 efforts in your state? Yes or no? And now I would like to thank President Kaplan, Dr. Osborne, and Representative Button for this excellent content. And thank you all who participated today. Also, we would like to thank our event committee for their dedication to ensuring that all children in Texas can be born healthy and thrive. And by doing so, making sure our current and future economy is strong. In closing, what we know is that high quality early childhood education is essential for workforce participation and has proven to have high economic returns on investment. There is a deep evidence base that policies that support healthcare, quality childcare, and child screening work. Texas could do a lot to improve its policies relative to other states. We had some great successes in this past session, but there is still a lot of work to be done. I would be remiss if I didn't mention the fact that this group greatly appreciates the bipartisan movement this past legislation session, working across the aisle to ensure that children are being taken care of. If you'd like to stay plugged in regarding this topic, please consider joining me as a Ready Nation member or one of the advocacy groups shown on this page. Contact information as well as the particular issue area is shown on the screen. I hope you have all found this information enlightening. Keeping an eye on your email as we will be following, keep an eye on your email as we'll be following with you all shortly to gauge interest, answer any questions, and solicit innovative ideas around leveraging childhood policies to keep our economy humming. Thanks again, and I hope you all have a great weekend.